I've wanted to be a nurse since I was about 6. I spent a lot of time in hospital myself as a child, and I was on dialysis for 4 years, and then I had a life-saving kidney transplant when I was 7. And I think the doctors and nurses when I was younger just made such a difference to me, and they were like a second family to me really, and I wanted to make that same difference to someone else. I think the main obstacles for me were people's attitudes and people's perceptions. A lot of people, when I tried to get into university and when I applied for jobs, they struggled to see past the disability. People just assumed because I had a disability that I couldn't perform even the simplest of tasks, even as much as operating a fire extinguisher. Getting into nurse training was particularly difficult for me. I mean, I went to careers advisors and they just look at me and say, why don't you apply for a desk job? And I'd say, well, I don't want to apply for a desk job. And then even when I did actually get interviews for university courses, the interviewer would just look at me before I'd even sat down and she'd say, I don't know if this course is physically suitable for you. Yet she didn't even know anything about me. I think the main reason I was treated differently since I set out to become a nurse was probably because people were scared, because they've never been faced with anyone like me before. I was made to feel like a liability really because of the way I look, and one of the things they made me do was carry out risk assessments, which no one else had to do, and this involved just having loads of people stand around watching me whilst I completed basic nursing tasks such as holding a baby or pushing a wheelchair. I think having a disability has actually made me a better nurse. I can fully empathise with the patients in my care because I've had similar experiences myself, so I know what they're going through. The ward I work on now is a renal ward, which is an excellent grounding for the future for me. But I know that I still have a lot to learn as I'm only newly qualified. This is disability to me. What's it to you?